Hi everyone, this is Marcella again from Dental Tourism Albania. Today I have the pleasure to sit with Dr. Adela Qorri from Dental Clinic Sibora. It's a beautiful name, so I'm going to question the doctor a little bit more about the clinic name, and we'll find out more about her and everyone else at the clinic. Thank you for coming here, doctor.
Thank you, Marcella.
Very nice to meet with you. So I love the name. Sibora means like snow. How did you come up with this?
It was that was the point. The teeth as white as the snow.
That's really nice. It's definitely very catchy. I love it. Dr. Adela, tell me a bit about you. How did you become a doctor, a dentist? I want to learn more about you as a person.
Well, I graduated from Tirana University at 2002. Since then, I've been practicing dentistry.
Okay.
It is very nice. It is a good profession, I think. And I like caring about people. I like my profession.
That's nice, huh? Imagine if you didn't. How did you decide to go into this profession? Often from other doctors I hear that, oh, my parents always wanted me to become a doctor.
I think I had another choice. No, my father is a doctor.
Okay, so forced.
That's why. And that's why.
Okay, so is he a dentist as well?
No, he's a radiologist.
Okay.
He's in retirement now.
Okay, but you kind of were exposed to medicine from
as well. Yes,
so it makes sense. So you've been in dentistry for over 20 years now.
Yes,
that's a very long time. You do not look it.
Oh,
you don't.
Very kind of you.
Talk to me about the clinic. How big is it? How many doctors in the clinic?
Well, we are 6 doctors. 1 surgeon, 1 orthodontist, we are 2 general dentists, 1 hygienist, and assistant, dental assistant. So in total we are 6.
Okay, so it's quite a lot of staff for a clinic in Tirana, because normally that's the range.
We hope to expand more, but now we are 6.
You're 6, okay, that's good. So definitely good plans ahead.
Yeah,
amazing. In terms of the services that are covered, so I know you mentioned a surgeon and orthodontics, so you definitely deal with this too, but can you talk to me about what other treatments you cover at Sibora?
Well, people are very interested in bonding composite.
Yeah, composite bonding, the buzzword.
IMAX veneers and crowns, zirconia crowns, especially these 5 years, and recently. So we are very focused on these treatments. Really, we are focused in endodontic treatments, in different kinds of fillings, and Invisalign, clear alignment, this.
I think you mentioned Eclair. Did I remember correctly? Because it was
Eclair.
Nice. So what is Eclair laser and what is
it's
it used for?
It's a diode laser with 2 wavelengths, 940 nanometer and 980 nanometer. It's specialized in disinfection of the root canal, in gum contouring, and every other treatment that is mono-invasive, mini-invasive.
Okay, mini-invasive. Okay, so when we talk about laser, if I put myself on the patient's side of the table, I would also want to know, lasers always sound scary. Does it hurt? So I know you said it disinfects, but...
the reason we are using laser is because it is non-painful.
Okay, so it doesn't hurt at all.
It doesn't hurt at all.
That's nice.
And we are looking for the results as well, because in these 20 years, the laser is introduced in dentistry. So we are looking for the results. but we are very happy with what we see.
So far it's proved to be very effective in the dentistry world.
That's the reason we are using it as well.
Okay, that sounds really good. I know a lot of patients come to us looking for alternative ways or different types of therapy, because often they have reoccurring infections, and especially with root canals, and they always look for, what's next, what's the best way for me to do it, so I don't have to come back for this because I keep coming back for the same problem. So I'm guessing using laser.
That's the reason we are using laser in root canal, in disinfection of the canals, in endodontic.
Okay. And is it used in surgery as well? Does it help when people do implants, or?
Yes. It's using, the surgeon is using laser in contouring gum.
Okay, gum contouring. So you also touched on composite bonding. This is a treatment that I have a lot of requests for. A lot of the, not necessarily young people, but everybody wants it because it's considered as prepless or minimally invasive, and now we are more educated into knowing that we want treatments that will enhance our smile but will not hurt our teeth. I do know that it's not the favorite treatment for a dentist to do, because it's a short-term treatment and you have to come back for it. So how do you manage these patients when they, when they insist that I want it? And end of story.
If the conditions are all right, it's very good for them to do that. It's a lot of work for us, but when the result is
beautiful smile,
we are happy too. So we
to
have
support
to
the patient wish.
So we have to do that.
But I'm guessing it's not for everyone, because I often see people wanting it, but sometimes their teeth are not aligned correctly, or the gaps are, so people still want it, but just because they see it online and it looks nice. So,
well, we have to work with them. We have to consult them, and we have to make sure that they understand everything that we suggest. There are different alternatives for every kind of treatment, so they have to be patient and to understand everything.
And I guess it helps when they know what they want. Okay. What is your experience working with what we consider dental tourism, but the reality is working with patients who are not local, who are not your the patients that always come to you, but now you are more exposed digitally, you are part of Dental Tourism Albania platform, so you get more exposure to other people coming from abroad to Albania to have fun, to have a bit of a holiday, and get their teeth in the same time. Are you experienced working with patients that are not Albanian, for example?
Yeah, because over the years, different people from abroad came to our clinics, Ibora Clinic, and they feel very, very comfortable, and they come back, and it's very nice working with other people, not only Albanians. They bring their culture, and it's nice, really nice.
That's nice, amazing. And where are your patients from? Where would you say are they mostly from? Would it be, which country would you pick?
Mostly from USA, Italy, Germany, Greece.
So it's very varied.
Yes,
that's
it's
nice.
varied.
Okay. And what languages are spoken at the clinic? Obviously, I know you speak English, but
we speak Italian, the staff, I mean.
Between you.
Italian and English.
Okay, so that covers a lot of people.
A lot, almost.
Okay, and when I always ask everybody, how do you make? There's two types of questions or two types of patients that I always refer to. One is, how do you manage a patient who is afraid of the dentist, which is like 95% of the population. Everyone's afraid of the dentist. Not you. Okay. So you've never had someone walk in and pretend that they're scared.
I have pain from my teeth too.
Okay.
I am human. Well, it's very important to treat them kindly and to create a very comfortable environment. And with the people that are afraid of dentists, we make sure that we explain everything, the procedure to them. So if they are not ready yet, we offer them another appointment. So we make sure they are really comfortable with themselves. Yeah, and with the clinic.
My next question is, let's assume that I walk in, I'm nervous, but now I'm calm, I've met with you, your staff, I know what's going to happen, so communication has played its part, but now I turn out to be a very difficult patient. I'm always talking when you're trying to work, and I'm always asking for like a lot of breaks, and then I complain, I don't like this hurts. And I just start becoming annoying to a point. How would you look after or manage this me in this case?
You see, it's really difficult, but we have to understand the emotions of the patients. So we have to be patient. We learned to be patient for ourselves during the years. It's cultivated. It's not
experience.
Yes. Okay. So it comes easy for us now.
So you don't even. It just happens.
The priority are the patients. So they have to be treated nicely, and it's the fear that commands them. So we can understand. Must understand.
Yes. I can see that you're a very patient person, and I have identified this in practically all of the dentists that I've met. So if I was to say, what do all dentists have in common, is that you are very patient people. Is this a criteria to become a dentist, or do you learn to become one by experience?
This is learned during the years.
Yes.
So we have to be. It's what we talked about earlier. We have to be this way. We are treating
people,
humans. So
no, it makes sense. That's fine. Dr. Adela, today was a very short podcast, just so we can introduce you to our potential patients, so they know who is the doctor at Dental Clinic Sibora. And so they know that you're a real person as well, with emotions, and that you understand their emotions too. In the future, I would like to invite you to our podcast again, where we can talk about specific treatments in more details, where we can offer patients what they would be mostly interested in, whether they'll be dental implants or veneers, as you said, to fully transform their smile. So we'll according to what the patients are looking for mostly, we'll come up with another plan together to meet up again, and we can discuss this in the future.
It's a pleasure, Marcela.
But for today, again, thank you so much for coming here.
Thank you.
It has been lovely to speak to you for the last couple of days and learn more about your experience.
Thank you, Marcela. I'm very honored, really.
Thank you so much. And again, cheers to my audience for watching and getting to know Dr. Adela. You know what comes next? It's Sirena.
Thank you everyone for joining us on today's podcast. Stay tuned for more and don't forget to follow us on our socials.